Hi, my name is Diana Bernal, and I am the program coordinator at Bronx Health REACH. The Bronx is a rich mix of people of diverse cultures, but is severely underserved in many communities with many food swamps and food deserts. Since 2010, the Bronx has consistently been ranked 62 out of New York's 62 counties when it comes to health outcomes, according to the Robert Wood Johnson Foundation County Health Ranking Report. And based on this, the Bronx has a lower food environment index, higher diabetes rates, and a higher percentage of adults who consider themselves in poor or fair health compared to New York and the US overall. According to the 2025 County Health Rankings and Roadmaps report Bronx health data, 36% of Bronx children live in poverty, which is more than twice the national average. Bronx Health Reach is a Bronx-based organization that focuses on reducing health disparities so we can address some of the determinants of health that lead to these outcomes. Before creating healthy schools and communities, also known as CHSC, we've been working with after-school organizations and community-based organizations on promoting healthy eating habits and access to physical activity. We've worked with food pantries on practices to help reduce food waste and improve fresh produce intake. And we've also worked with Bronx-based organizations and Bronxites on advocacy projects to make walking and biking in the Bronx safer. CHSC afforded us the opportunity to work with schools from which the after-school students were from to improve food cultures there and to address the concerns about reduced physical activity and physical education. Also, CHSC allowed us to work with surrounding communities to make streets safer for physical activity and to improve the nutrition quality of the food in food pantries that many Bronx residents rely on to feed themselves and their families. Through CHSC, we were able to work with different schools, faith-based organizations, food pantries, early care education partners, and transportation advocates on many different initiatives. One initiative focused on improving school wellness, where we helped schools address problem areas such as high teacher turnover rates, absenteeism, behavioral issues, and excessive screen time. This work began during a time when communities were trying to establish a new normalcy after COVID, where health and wellness were often put in the back burner due to different demands from different entities. And because of this, we wanted to meet schools where they were at and help them see how to utilize health and wellness initiatives. So we connected schools to organizations like Equity Design, which met with each school individually to assess their needs for their students, staff, and community. We've worked with schools to help them establish or reestablish school wellness councils to work on health initiatives. Schools across the Bronx implemented a variety of creative strategies to tackle their problems. Some initiatives included creating a teacher wellness lounge, walking clubs, providing counter marketing education, and implementing school gardens. One initiative that many schools adopted is the use of open streets, which is a Department of Transportation initiative that limits car access with barriers, signage, or other traffic devices, and prioritizes pedestrians and cyclists. Through open streets, schools are able to shut down a street around their school, creating additional space that is open and safe for recess, physical activity, outdoor learning, and more. These school wellness initiatives have helped build morale in schools, and the Open Streets initiatives have been a big success. Schools have expressed how both staff and students have fun and how community members that were once resistant to the initiative now want to know how they can help. PS59 has expressed how the Open Street Days has helped them reduce their absenteeism, and PS18's Bike Fest has shown them and other schools around that it is possible to shut down multiple busy Bronx streets for the kids to bike safely. Now that the foundation has been laid, we want to ensure the sustainability of this work. We've been working with school wellness councils on establishing health and wellness policies that don't feel like an added task, but more as something that is part of their school culture. We're also expanding our communication district-wide to community education councils and seeking opportunities to increase youth leadership around school wellness efforts, such as youth food justice empowerment. When thinking back on these 5 years as a whole, I'd summarize the legacy as reconnecting people to movement, each other, and the outdoors. We've built a stronger awareness and commitment to improving nutrition and physical activity. We've deepened community efforts and strengthened collaborations with city agencies, setting the foundation for sustainability and for community members to take the lead beyond the funding period.